Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens, and we have a surprise for everyone today. We have Dr. Grove.
Great. Hi, Dr. Grove.
Hey, good morning, guys. How are we?
We're living it up. You sound good. So, Dr. Grove, are you in the gym?
Just got out of the gym.
All right, we love that.
It's nearby, always nearby, Doc.
So, Dr. Grove is my associate, and he's one of the best injectors on the planet, doing regenerative medicine of stem cells and platelets. He's been trained very, very well and uses ultrasound for almost all of his injections. There's some injections we don't need to use ultrasound, but most we do, and ultrasound is the type that's like a little camera that looks inside the body, so you don't need to get an MRI or an X-ray. We can look immediately and see what's going on. But also, very importantly, is if any of you go to a doctor for injections for orthopedics, and although we don't endorse steroid shots like cortisone, that's what most people end up getting. Even if it is a cortisone shot, you want to have your doctor use an ultrasound, because the studies show that if you don't use an ultrasound in, let's say, a knee joint, you're going to miss the joint at least a third of the time. So whatever solution is being put in there, if it's regenerative medicine solutions like platelets or stem cells, it's mandatory to use an ultrasound. So Dr. Grove, I want to get a little background on you so people can hear, but first I want to give out the phone number to the studio so you can talk to us live if you want to call in. And that phone number is 866-870-5752. I'm going to repeat it while you grab a pen and pencil. 866-870-5752. If you're driving, it would be smart to pull off to the side of the road and take your Bluetooth off so we can hear you very well. And if you write the number down, if you're shy, you don't want to call the show, and we hope you're not shy because we love our callers. It makes the show a lot more interesting. You can also call the office, and the number to the office is 800-300-9300. That's 800-300-9300. We have people by the phones now if you want to call in, and if we miss a subject that you want to talk about, my staff is amazing. They know this stuff backwards and forwards. You'll get a free phone consult with my staff if you call the office. And also, if you want to watch videos of Dr. Grove and myself, you can go to our website, which is www.jointrehab.com. That's www.jointrehab.com. So, Dr. Grove, tell us a little bit about your background and how you got into regenerative medicine.
Sure. So my journey to regenerative medicine came from the athletic background. So I was an athlete growing up. I ended up playing football for the University of Nebraska. I was a linebacker there, was a captain there. From there, I really got exposed to the whole world of high-end athletics, which is where I first was exposed to regenerative medicine with prolotherapy, which Dr. Darrow is one of the original pioneers of an awesome therapy called prolotherapy, which later turned into PRP and stem cells. So after college, I ended up getting into the strength and conditioning, human performance realm. So I take contracts with private athletes So I lived with pro athletes, do all their cooking, all their training. That took me to about 60 countries all around the world. From there, med school was in Pennsylvania, so I was mostly based out of Pittsburgh, and then residency was in Dallas, Texas, where I did a lot of treatments with stem cells there, especially with bone marrow. From there, I went to an amazing sports medicine fellowship with a lot of very high-end ultrasound musculoskeletal training at Virginia Tech. From there, I am in beautiful, sunny Los Angeles.
So I want to make a comment about Dr. Grover, several comments. My experience of him, he's probably the smartest doctor on the planet. And I don't know what his IQ is, but it's probably through the roof, because I question him all day long, and he always knows more than I do. And I'm a perennial student. I mean, I look up everything I don't know. I love learning. And I'm always shocked about you, Dr. Grove, that you seem to, like, I know level 8 and you know level 10. You seem to know it all. And it was interesting when you first came to work with me. You watched my techniques for about a month, which were similar to yours, but, a little bit different. And then after about 30 days, you said, okay, you can leave the room now. You don't need to be here with me anymore. I felt hurt. I was like, what am I going to do? But as my patients know, my listeners know, I've been doing this work for, I think, 27 years now. And my hands are kind of worn down. So I have trigger fingers, which I work with, so they function well. But they get stiff easily, so I'm not injecting anymore. Dr. Grove is doing all the injections. I'm still at the office and managing everything. It's people don't understand. It's not easy for most doctors to take good care of patients because their head is on in the science. And we're a little different. We want people to have a really happy experience. So that's really what my job is now, is the management and taking care of the patients, making sure the office runs really smooth. And Dr. Grove is on the forefront doing all the injections. I'm there. A lot of patients who have known me for 20 plus years say, I only want to see you, Mark. And so I'll come in and then introduce Dr. Grove, and then they fall in love with him. He's a 6'2" hunk of muscle and very handsome dude. And he's got a great personality, so people love him. And, he knows pretty much everything about sports, so he's fun to talk to also. So I'm going to give out the phone number, and then we'll ask you some more questions, Dr. Grove. The phone number to call us right now, you can talk to Dr. Grove live, ask him questions, or myself, Marc Darrow. And the phone number to the studio is 866-870-5752. I'll repeat it, 866-870-5752. If you feel like calling the office, you get a free phone consult with my staff, not with us. And you can call anytime. There's people by the phones. And that phone number is 800-300-9300. That's 800-300-9300. The website, if you want to watch these injection procedures of platelets and stem cells, you can go to www.jointrehab.com. So, Dr. Grove, what is PRP?
PRP, it's platelet-rich plasma. Really amazing tool that we use in regenerative medicine to help heal musculoskeletal injuries. These are cells that are naturally occurring in your own body. The trick is we just have to get to those cells. So the way that we do that is we do a blood draw, like you're given a blood test. From there, we put it into a centrifuge. It's a machine that spins the blood down really fast. From there, we can take out the red blood cells, and we're left with this nice golden color of PRP that we use to deliver to areas we want to heal, whether that's a shoulder, a knee, a hip.
Well, it doesn't matter where, right? I mean, we
Exactly.
inject the entire body. I've done everywhere, and you have too. The back of the head for, believe it or not, a lot of times there's a mistaken diagnosis that walks in the door. And we actually find that most diagnoses that come in are wrong. And so one of them, we just had a patient call in about that, was occipital neuralgia, which is pain in the back of the head. And the typical thought from most doctors is that it's the greater occipital nerve that's being impinged on. And so they get into fancy steroid shots and things that aren't going to work. They may work partially and for a short period of time, but then the anti-inflammatory effect of the cortisone or the steroid wears off, and you're worse off because the tissue is damaged by the steroids. So what we do is we palpate everything. And I was going to say we treat everywhere from back of the head all the way, to the neck and shoulders and the arms and elbows and fingers and wrists and hips and knees and hamstring muscles, toes, ankles. There's no part of the body we don't heal. And with the ultrasound, Dr. Grove can actually see these little minuscule tears that aren't going to even show up on an MRI. The MRI is more of a gross study. And the nice thing about the ultrasound, we have 3 of them in the office. We just wheel them from room to room. So it's like a live X-ray. You can see immediately. You can see so much more than you can with an MRI. Also, MRIs are often overly sensitive. We know that MRIs have a high sensitivity, and they show things that really are not there. And one of those that we see frequently are torn ACL tendons or ligaments in the knee, the anterior cruciate ligament in the knee. People come in with a swollen knee. They hear a pop or something like that, which is not usually that ligament. It's usually the patella that is outside of its trochlear groove in the femur. And they'll feel this pop and think they ripped a ligament when they didn't. But the knee swells up. They go to a surgeon. The surgeon doesn't have an ultrasound. He doesn't know how to take the fluid out. We take the fluid out immediately. And if it's red, we know it's blood, which means there's a tear. Okay? But tears don't have to be operated on in almost every case that I've treated. If we get the blood out immediately and put in some stem cells, that knee can start healing right away. Another key to this is if you do get an ACL tear, anterior cruciate ligament tear, in your knee, the studies show do not operate for at least 3 months. The better outcomes are waiting for that knee to heal. Most surgeons go in right away, and we see a lot of terrible outcomes. We're the guys that see all the bad surgical outcomes. So we have a lot of patients with what we call failed surgeries. There's a diagnosis called failed back syndrome. That means someone gets a back surgery and they come out worse. It failed. For an insurance company to have a diagnostic code means this happens all the time. These surgeries fail all the time. Back in the early days when I first started the show, probably, I think it was about 22 years ago, we had an orthopedic, or actually it was a neurosurgeon on this show. And I said, how often do your surgeries work? And he said, only about 50%. And he was one of the best guys in town. And not only was he conservative, but he would make the patient come in minimum of 3 times trying to talk him out of these neck and back surgeries before he would operate. And he'd bring the family in. He wanted everybody to know what the potential sequelae, those are after effects of surgery, the side effects can be. And Dr. Grove and I have seen so many patients with failed spine surgeries that are so bad off, they'll end up getting morphine pumps, spinal stimulators, these things that just are no good for anybody. They often can get infected and have to be taken out again. So we have to be very careful. I'm not against surgeons. I absolutely love surgeons. They do the hardest work in medicine, but I don't like the surgeries that they do. If someone has a broken bone, fractured spine, yes, surgery is probably the answer. But these meniscal tears in the knees, rotator cuff tears in the shoulders, we see them failing way too often. These joint replacements, hip replacements, shoulder replacements. My father-in-law actually had an ankle replacement on the East Coast. And he's doing pretty good, but, he actually came in the office. He came to California one time to visit us many, many years ago. And I did prolotherapy. That is an injection with concentrated dextrose and lidocaine. And his ankle healed up. And then somehow or other, in my humble opinion, he got seduced into an ankle replacement when he didn't need it. I never told him that. I didn't want to get into the family problems, but that's my opinion. Too many of these surgeries should not be done, in my humble opinion. So, Dr. Grove, why is it that you want platelets placed in areas of injury, the PRP? What does it actually do?
Yeah, so these are the natural healing cells of our body. These are the cells that if you have an injury are going to be hanging around to try to heal that tissue. So, our challenge is to try to deliver those cells to the correct area that needs to be healed. So it's not a super complicated process. These are your body's natural cells to heal. We're just putting them exactly where they need to go to speed up that healing process and improve your outcome.
Okay. So you also do what we call BMAC, bone marrow aspiration. And what's the procedure for doing that? And do the patients mind it, or is it easy, or is it tough? What's the story? How long does that take to do?
Yeah. So, PRP is certainly a good option. I think a better option is to go that bone marrow route. So these are your body's natural stem cells. Trick to this one is you just got to get inside the bone marrow, which sounds like it'd be this big procedure. But again, compared to something like surgery, this is nothing. We put a little numbing medication over the top of where we're going to go into the bone, use a small needle to pull some of that bone marrow out, which has both your own stem cells and platelets. From there, we can now deliver those cells into any area that we want to, get some healing going.
Is there any reason to actually draw blood when you're doing bone marrow aspirate?
Yeah, so the beauty of doing bone marrow aspirate is you do not need to take any blood out because there's already platelets within that bone marrow. So it's a relatively fast procedure. Once we get you sat down and cleaned up, a couple of seconds to get that bone marrow out.
Yeah, and personally, I've done about 7,000 of them over the years. And it takes me about 15 seconds to do it. And again, this is something, we're not saying that regenerative medicine of PRP, platelet-rich plasma, or stem cells is for everybody. We have to choose you just like you have to choose us. There are patients that we turn away. One category of that, which is somewhat complex, is if someone has pain down their leg. They may have what's called a radiculopathy or a pinched nerve that's coming from the spine. And that may be a case where a person has no back pain at all, but just leg or arm pain. And that might be a case that we would send, as an example, we have a friend in Santa Monica named Randy Weinzoff, who is a chiropractor, and he is able to get rid of most of these radiculopathies. If someone comes in with the back pain, we can handle that. And then we might send the person out to Dr. Weinzoff to block. Actually, what he does is he realigns the spine and takes the pressure off the nerves. And that can really help get rid of, from the neck down the arm or from the back down the leg. But we have to be careful also. I just had a woman come in who was a good friend. She said she had to have a hip replacement. So I was very concerned. I had her come right in. She'd been to an orthopedic surgeon, and I moved her hip around. I looked with the ultrasound. There was no arthritis there at all. And she had no issue with her hip joint, but she was going to get a hip replacement. So what Dr. Grove and I do is we actually palpate the area. That means we touch it, we move it, and we find out where the pain is actually being generated from. That's a new concept for a lot of doctors. I know that. But really, it's ridiculous to me.
No, it's a really good point. Yeah, if you work in musculoskeletal medicine and you're not putting hands on patients, you should really reevaluate who you're going to for your medical care. It's a really good point, Doc.
When we have patients who come in with a failed back syndrome, meaning they had a surgery or a knee or a hip or whatever it is, shoulder, neck, I always say, did the surgeon touch your body? And once in a blue moon, they'll say yes. But most of the time what they say is, no, the doctor never touched me. He put on an X-ray or an MRI on the light box and showed me the problem and said I needed surgery. Now, to me, in my humble opinion, I'm not putting surgeons down. I don't put anybody down. Everybody has their culture. But it lets me know that way too many surgeries are being done that never had to be done to begin with. And I know a lot of you listeners are sitting there going, geez, that was me. I had that surgery and it didn't work. So be very careful. If you do get a diagnosis from a surgeon, go to a doctor who's not a surgeon. Go to a doctor who specializes in manual medicine and regenerative medicine, somebody that will touch the body and see if you can heal without surgery. And look, surgery is amazing sometimes. There's no question about it. But from what we see, there's way too many failures and way too many times when it never should have been done to begin with. So anyway, this friend of mine who came in, I examined her and I said, you have a gluteus medius sprain, which is a muscle that attaches to the back of the pelvis near the hip joint. And she said, how do you know that? I said, because when I touched it, you screamed. And you said that's where the pain was coming from. And I said, darling, that's not your hip and it's nowhere near your hip. I know on you, you think it's 3 inches away from the hip. But in the medical reality, it's eons away. It's light years away. It's just nothing to do with where your pain comes from. And we see this all the time. We see terrible surgeries that are done. There was a woman that came in, it was the same type of an issue. She had a gluteus medius sprain on her pelvis. She had her sacroiliac joint bolted together. Mm-hmm. I could feel the bolts through the skin. And she had, the pain got worse. She went back to her doctor. The doctor said, if I don't do another surgery, you will be paralyzed. She came in with her husband, and I examined her, and I said, there's probably an 80 to 90% chance I can get rid of your pain by doing PRP or PRP with stem cells. And they were both very happy about that. And then the woman said, but doctor, even after I'm better, I'm going to get that surgery. And I said, what? And her husband said, honey, why would you say you would get the surgery if you're healed? And she said, because the doctor said I will be paralyzed unless I get the surgery. And we see that all the time. All the time. There's a fear factor that is put upon the patient. And I call it getting slimed. You know, where, you have the dinosaurs of medicine that are scaring patients. And it just happens way too often. And again, I'm not putting the surgeons down. That is their culture. Another one that happened when I was at UCLA in my residency, a man came in on crutches, and he had had 3 neck surgeries because the surgeon said, if we don't operate, you will be paralyzed. Each surgery successively made him worse, and his legs got weaker and weaker. He came in, and I said, did you ever have a blood test to see what your micronutrients are, meaning your vitamins, your minerals, amino acids, antioxidants? And he said, no one's ever mentioned that to me. Well, we did that. Guess what we found? Dr. G, any clue? We're going to go to the break, then we'll get back and answer this question about what happened to this poor gentleman. And give us a call at the studio. Talk to us live, 866-870-5752, or call the office, 800-300-9300. Thank you.
And we'll be right back after this.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.